John, the president went in front of cameras today, made claims about this virus that go against everything that we're hearing from medical experts. Is this why he wants the briefing room all to himself so that he can spread misinformation?
Look, it was a step backward today. Yesterday, when the president resumed these briefings, he seemed to suggest that he was going to convey a more serious attitude about the crisis. He urged people to wear masks in ways that he had not done before. He said it's going to get worse before it gets better. He seemed to be girding Americans for the really difficult challenge ahead, trying to rally them. But that only lasts for so long. Today, the president came back, second day in a row, without medical experts who can actually provide the information Americans need to conduct their daily lives and develop an understanding of where we're headed with the virus. And he made these statements like, kids don't transmit or don't catch the virus and bring it home from school and infect family members. Well, there's a new study from South Korea that says kids from 10 to 19 do it as much as adults do. So that's simply false. And the president was using that false information in an attempt to boost his argument for school reopening. He bragged about the declining test positivity rate and said it's way down from the peak in April. Well, yes, it was down from a peak in April, but it went much further down, and now it's gone back up. Now, the hope is that we will get it down again, but the president gave the indication today that really what this was about was putting him in front of cameras, letting him promote himself as he's running for re-election, not for constructively helping Americans get on top of this virus.
Yeah, it was going down and then back up like a backwards check, right? Because, but it doesn't
exactly.
show. Yeah, exactly. So listen, the president implied in an interview with Fox News tonight that he has a friend who is dying of the coronavirus. Let's listen to this.
I've lost 5 people, probably 6, actually, as of this moment, I think, pretty soon. But I've lost 5 friends that went in, and, you know, that's happened on numerous occasions. Probably happened to you with people, too. I never remember anything like that. It didn't. I mean, I never remember this happening with the flu.
So the president says things like this, but he has spent months, John, downplaying the severity of this virus and even acting like it's over. It's a very mixed message with clear strategy that he can't even seem to articulate what it is.
Right. I think the president uses that statement to reflect, I'll take him at his word that it's reality, that number of friends of his have died. And by mentioning that is a way for the president to signal to others, I get it. It still doesn't substitute for the lack of expressions of empathy for the 140,000 plus Americans who have died of coronavirus. And it doesn't substitute for a meaningful plan, meaningful action in a more aggressive way than he's shown so far. That seems to be a small personal emblem that he understands, but not enough to move him to do what presidential leadership would require in this situation.
When you think about that, and he's been saying, you know, it's the sniffles or that most people get over and it's like the flu, and then he just said in that soundbite, more than I didn't know anyone from the flu, so I don't know. Anyways, the president also brought up his cognitive test again in that interview. Take a listen.
I said to the doctor, it was Dr. Ronnie Jackson, I said, is there some kind of a test, an acuity test? And he said there actually is, and he named it, whatever it might be. And it was 30 or 35 questions. The first questions are very easy. The last questions are much more difficult, like a memory question. It's like you'll go person, woman, man, camera, TV. So they say, could you repeat that? So I said, yeah. So it's person, woman, man, camera, TV. Okay, that's very good. If you get it in order, you get extra points. When you go back about 20, 25 minutes later and they say, go back to that question. They don't tell you this. Go back to that question and repeat them. Can you do it? And you go, person, woman, man, camera, TV. They say, that's amazing. How did you do that? I do it because I have like a good memory, because I'm cognitively there.
So why does he feel the need to repeatedly talk about passing this test? Our medical analysts say that it's a pretty basic test.
Let me get my mind around this. CNN, Don, question, answer, go. Okay, so what I would say about the president is he is somebody who clearly, consistently feels the need to exaggerate his own attributes and his own accomplishments. He brags about having gone to Wharton. Mary Trump, of course, said in her book recently that he paid a friend to take the entrance test, the SAT, to get him in there. He brags about knowing more than generals. He brags about having a special talent for medical stuff when he goes in front of the cameras. I don't know how many times Daniel's fact-checked him on saying, I passed the Veterans Choice Act, which nobody else could do when, in fact, it was Barack Obama. He has to affirm his ego, and in doing so, he consistently lacks self-awareness of how that comes across. So when you boast about this test, which is a test designed to screen for dementia, and say that by showing you don't have dementia, that makes you really smart, it makes him look ridiculous, frankly, and people are laughing about that clip. And I'm not sure it proves the point the president thinks it proves, because if you were really brilliant, you would have enough self-awareness not to think that the questions on that test would be an indication of tremendous mental capacity.
Yeah. Well, and even just to, yeah, you're right, to put it out there, you don't even have to tell anybody you did that. I guess it's because he wants people to think that he's sharper than Joe Biden. He's trying to say Joe Biden is not sharp, drawing a contrast there that is not really working in this
But he
moment.
doesn't prove that.
Yeah, exactly. Thank you, John. I appreciate it. I want to bring in, John mentioned Daniel Dale. Here he is, our resident fact checker. So there you go, Daniel. I want you to take a listen to what the president said about this recent spike in coronavirus cases. Here it is.
Cases started to rise among young Americans shortly after demonstrations, which you know very well about, which presumably triggered a broader relaxation of mitigation efforts nationwide.
So what is the truth, Daniel?
There is no good evidence that the racial justice protests were a significant cause of the recent spike in coronavirus cases. Now, Don, experts caution that it's still early. We're still learning about how this spread happened. But in numerous cities where there were large repeated demonstrations, including New York City, Minneapolis, Chicago, we saw no sharp uptick after the protests, possibly because they were outdoors. Many protesters were wearing masks. And I'll add that it's strange the president is suggesting that these protests led to a relaxation of mitigation measures. At the same time of these protests, he himself was urging a relaxation of mitigation measures, saying the country has to get back to normal, has to open up. So the idea that, governors relax restrictions because of the protests rather than because of him, I think is pretty strange.
And then calling people who were not socially distancing or wearing masks, what do you say? They were patriots because they wanted liberty and to liberate, certain states and certain people. Yeah.
Yep.
So, Daniel, listen, the president also tried to place some blame on Mexico. Watch this.
We're also sharing a 2,000-mile border with Mexico, as we know very well, and cases are surging in Mexico, unfortunately. 257 miles of newly constructed wall along the southern border has had a great positive impact on people coming in, and we have record low numbers of people coming in illegally. That's helped greatly. It was really meant for a different purpose, but it worked out very well for what we're doing right now and for the pandemic.
Okay, Daniel, give us the facts.
This is such a weird paragraph, if you can call it that, because the president is simultaneously vaguely suggesting that Mexican migrants contributed to the spike in cases. And then he's also trying to boast that he's keeping a record number of Mexican migrants out with his border wall. It's strange to argue both at the same time. Beyond that, Don, there is, again, no evidence that migration from Mexico is driving this uptick. Mexico's number of cases, at least recorded cases, is way less than the U.S. recorded number. Now, there are caveats here. Mexico does have an increase in cases and deaths, and Mexico has very limited testing. So we have to be cautious in the comparison between Mexico and the U.S. But again, no firm basis for blaming Mexico for this U.S. domestic problem.